Hi guys, welcome to another video. So like I mentioned before, today I'm going to be talking about cervical/cervical cancer, whatever you want to call it, it's correct. And I'm going to be talking about where it happens in the body, how you can, what symptoms you have and that would make you suspect you have cervical cancer, how we can test for it, what are the risk factors for it, how we can prevent it, and what exactly causes it. Alright, and the last part of the video is focusing on a follower request. So I had a follower ask me about the side effects of getting vaccines that prevent cervical cancer, and they're completely safe. That is the short answer, and for the long answer we'll be doing it further in the video. Alright, let's go further. Right, so if you remember the diagram of the uterus, so you remember this is your uterus, these are your tubes, these are your ovaries, and this is your vagina. And the upper part of your vagina that connects with the uterus, that's where your cervix is. So, this part, this is your cervix, and that's where you get cervical cancer. How do you know you have cervical cancer? So there's a couple of symptoms you can get. You can either bleed. So this bleeding can be more bleeding than you normally have. The regular menstrual bleeding, this could be more in amount. Or it could be this, you could have bleeding between your cycles. So imagine you're having a menstrual cycle and then it gets over and you're supposed to have your menstrual cycle again next month. But in some cases, people have bleeding in between their cycles, or sometimes people have bleeding after sex. Then you keep getting recurrent urine infections. So people keep having urination problems. You have to keep going to the doctor for, getting yourself tested. Some people might also have some very foul-smelling discharge. So this is the kind of discharge that is abnormal. I will be doing a video on discharge later and we'll talk about more kinds of discharge, but any abnormal discharge. And pain. So people have lower abdominal pain or pain just above their, the place where you pee from. So just in your vulva area, you might have pain a little bit above your vulva area. So how do we test it? In the previous video, I showed you how a cervical smear test happens. So they take a brush and the bristles of this brush are rubbed over your cervix where they collect cells. Then these cells are put on a slide and this slide is examined under the microscope. Now, if precancer cells are present, that means you have a higher risk of getting cancer. So cervical smear positive test does not mean it is 100% cancer. It could be cancer. It could also be that you're more predisposed to having cancer. What are the risk factors? So in your pap smear test, your smear test, you can get precancer cells present. The other two big risk factors that are important for us are smoking and alcohol. So cessation or cutting off smoking has a very big association with reducing your risk of cervical cancer. So how does it spread? So 99.7% of cervical cancer cases, they are associated with HPV. HPV is human papilloma virus. Other than causing cervical cancer, they also cause something called genital warts, WARTS. So in case, it could be a low-key thing like a just genital infection, or it could range even up to cancer. The two strains that are most commonly associated with HPV are strain number 16 and strain number 18. And there is a vaccine to protect you from this. The other way you can protect yourself from this HPV virus is by condom use. So remember how this condom fits over the penis? And in case this is being introduced into the vagina, because there's a physical barrier over the penis and the penis is carrying the infection, it won't interact with the vagina itself, the cavity, because there'll be a physical barrier on it, and it is less likely to transport the HPV virus. Now, the important thing to note here is it's usually men that introduce HPV virus in women. So men are carriers of HPV and then they introduce it in women where it can cause cervical cancer. What is seriously important to remember here is that this can also spread through genital touching. So anything like fingering or oral sex can also spread it. So condoms are not the safest way to prevent this, but condoms are good overall to prevent STIs, sexually transmitted infections. what you can look at here is vaccines. My concern is, I want to talk more about vaccines, is because there's been a very big anti-vaccination movement in the West of late. So people think vaccines cause different diseases. I'm going to be talking about all of that. But what you need to remember is that we've had the cervical vaccine since 2006. And since 2006, more than 200 million people have been injected with the HPV vaccine. We don't have any severe side effects reported yet. Just like with any other vaccine, you have some simple side effects, like there will be some redness at the site of the injection. There will be some fever, maybe, a mild fever. There can be some pain, but there's no severe adverse effect reported with the use of HPV vaccine. That's what's important to remember. Another interesting thing about cervical cancer vaccine is that, so it's routinely given to women. Usually in India, it's given right before the women are getting married, because they assume that women will have sex after marriage only. Unfortunately, our society works in this way. So if you're sexually active, I would recommend getting the HPV vaccine, irrespective of whether or not you're married. This is a social construct and you can get past it. So in the UK, what they're doing is, because men are the ones that carry the HPV virus, they are the ones who introduce it to women, school-going men are routinely going to be offered the HPV vaccine. It's called Gardasil or it's called Cervix. Routine use in school-going children will be offered in the UK so that we can reduce the transmission rate. And also, trans people can be offered it. So imagine if you're a person who's been assigned female gender at birth, and you eventually undergo a gender reassignment surgery. But if you've had any interaction, any sexual intercourse with anybody who has had, who has a penis essentially, then they might have exposed you to HPV. On the converse side, if you are somebody who's been assigned biological male at birth and you identify as a female, then of course, you have chances of having HPV on your pre-surgery genitals. So which is why it's very, very important that, you get this vaccine as well. And it is available for trans people as well. So we've had this vaccine since 2006 and it protects against 4 strains. So if you remember, I mentioned here, 16 and 18 are the most highly cancer-causing ones. So it prevents against 16 and 18 and 2 other strains called strain number 6 and strain number 11. Just want to talk about how safe the vaccine is once again. It is approved by the FDA, the the Food and Drug Administration. It's quite a strict authority. They don't approve anything just right away. And there's a very big anti-science movement happening these days, which promotes that vaccines are unsafe. Let me just confirm this for you. Vaccines are completely safe. Vaccines are great for you. We've reached a level in modern medicine and modern science where we can jokingly deny the use of vaccines. But we wouldn't be where we are as humanity without vaccines, without modern medicine. So it is approved by the FDA. So usually you get 2 vaccines. Sometimes people also get 3 vaccines, and they're usually at least 6 months apart. The common side effects are a light fever, some pain and redness at the site of injection, and the rare side effect is allergy. And this is what can get serious. So if you get an allergic reaction, you need to be in the hospital. This allergic reaction can be ranging anywhere from like mild itching to your breathing becoming labored and you having problem breathing, which is when the hospital can take care of you. This is a regular allergy. If you're allergic to peanuts, the peanuts will cause the same issues just like this vaccine will. So it's not like there's anything bizarre with the vaccine that's causing allergic reactions. Over 200 million people have been injected with this vaccine and there have been no serious side effects reported. There is some papers that suggest it causes premature ovarian failure. So premature means before time. Ovarian as in your ovaries, and failure. So it sometimes causes, there is some reports that say that it causes failure of your ovaries to work normally before their time. Once again, this is just one of those things you hear on the internet which is complete and utter bullshit. And it does not cause any premature ovarian failure according to all the data we have. If you all want, I'd be very happy to send over some links about the side effects or the dangers of getting vaccines, which they are none, by the way. No dangers. If you are capable of getting a vaccine, get the vaccine. It's great for you. So, just to talk about why this is important is because cervical cancer is the commonest cause of cancer in rural women in India. In urban populations, breast cancer is more common, and we hear about breast cancer quite often. But I feel like cervical cancer is something we don't talk about enough, which is why I think it's very, very important to have a conversation about this. And it's surprisingly common, this disease. The interesting thing about it is that in a lot of cases, there are no symptoms with it. So a lot of people don't know that they have a cancer until it's gotten very, very advanced, which is why it's very important that you go for regular pap smear, the smear tests where they put the brush, the one I also explained in my last video. So I think, yeah, it's a great idea to get the smear test done quite regularly. In the UK, we do a smear test every 3 years if you're between the age of 25 and 49. And then, the pattern changes as you grow older or depending on how much risk you have. That essentially is all I wanted to talk about today. If there's any questions, the usual protocol, you can drop me a DM. I will be happy to talk about things, anything you want me to talk about in particular. Next up, I'm going to be doing a video on the discharge. That was supposed to go up next after contraception, but I felt like if I talk about cervical cancer along with the pap smear, I think it works better. So cervical cancer is coming up now. After that, we're going to do a video on discharge. There's another interesting video suggestion I've had for people, things to know for people who are about to have sex for the first time. So I think that could be very helpful for a lot of people, especially our younger Instagram generation. And I hope this video helped you. Keep busting science myths, keep busting sex ed myths, and as always, my love. And let me know how I can answer more questions for you. Alright, have a lovely weekend, guys. Bye.